Millions of people are diagnosed every year with diabetes, and Dr. Richard Hightower with the Southcoast Medical Group is here today to talk to us about the disease. So, let's talk about this. Say the person out there, everybody hears diabetes all the time. What is diabetes as a disease?
Well, diabetes is actually a metabolic disease where people experience high blood sugar levels, either because they don't make enough insulin or because the insulin they make is resistant to the cells in their own body. Now, most of what we see is in that latter group. And that's what we consider type 2 diabetes. Type 1 diabetes generally is early onset in life, and it's when the pancreas doesn't make insulin appropriately. And this is almost always picked up in children. Sometimes adults can have it too, but compare that to type 2 diabetes, it's a condition of insulin resistance where you make insulin, however, it doesn't bind properly to the cells, therefore the blood sugar can't get into the cells where it's needed for metabolism. Along with diabetes, there are other comorbidities. For instance, one very concerning thing about diabetes is that it has a very high prevalence of heart disease. In fact, 2 out of every 3 diabetics will eventually die from either a heart attack or a stroke. It's very important to get into look at other conditions like high blood pressure, high cholesterol, screen patients for cigarette smoking, because all of these modifiable risk factors have to be treated very aggressively along with controlling the blood sugar.
I like what you said, you put it modifiable risk factors, because I do not have diabetes, but if I was faced with that diagnosis, the first thing I would think of is insulin shots for the rest of my life. I have to do certain things. But you're saying there are things when you work with your doctor that insulin is always, a possibility, but there are things that you can help manage your diabetes to where it might not be that serious.
Absolutely. The first step in all this is education. Learning about diabetes, learning about the disease process, and what you can do yourself on a day-to-day basis to modify your behaviors so that you can have a significant positive impact on your disease. Weight loss, very strict diet, controlling other symptoms or other behaviors like cigarette smoking, regular exercise. All of these things are first-line therapies for diabetes. Now, some people are going to require medication, and there are several different types of medications available for treatment of diabetes. Some are oral medications that are taken, and some people do require insulin. So your doctor will be able to figure that out with you, but the treatment starts with therapeutic lifestyle changes.
Well, let's talk about where we are right now. You guys are, you see all kinds of patients with diabetes, from little ones on up to people that are diagnosed later on in their life. So if someone is facing a diagnosis, tell us about what they would find if they walked in the door here and made an appointment with you guys.
Well, generally what will happen is we'll bring them in and we'll perform a good history and physical examination. And the testing for diabetes is really rather simple. It's some simple blood testing. Generally, if you have 2 fasting blood sugars greater than 126, then that's diagnostic. Or if you have a random blood sugar of over 200. Sometimes we do other tests like hemoglobin A1Cs, and in general, if that number is over 6.5, that's consistent with a diagnosis of diabetes.
Well, we talked earlier before we started the interview about certification and certain things. Tell me about your staff here. You have certain criteria that you hope they'll all meet. What does that mean to the patient, these certain things that your staff goes through to be certified?
Well, we're very involved with the National Committee on Quality Assurance, and this is an organization that's a nonprofit organization whose primary goal is to improve health care. And what they do is they collaborate with doctors, health care plans, policymakers, and determine what the most important health risks are facing our society. And they find ways to measure it. They find ways to help improve care among health plans and among healthcare organizations. We've been involved in this for a number of years now, and it's a very rigorous process that we go through. Not only do you have to practice very high quality evidence-based medicine, but you also have to undergo a very rigorous documentation and reporting system as well. And fortunately, our physicians have been very successful in this, and we place a very high priority on getting this NCQA certification. Having that NCQA seal really is a good marker for an organization that can provide very well-managed, high-quality care for their patients, and we're proud of that.
Okay, so if there is a parent or a person out there that suspects their child or they themselves might have diabetes, what's the first course of action? What should they do?
Well, the first thing they should do is come see their doctor, particularly if you have risk factors and some of the symptoms that we've discussed. Secondly, when your doctor makes a recommendation for a plan, gets you to the diabetic education, is to really engage that and to take that education seriously. The therapeutic lifestyle changes are extremely important. Exercise, weight reduction, and along with that, making sure we modify any other medical issue that's out there, such as hypertension, high cholesterol, and smoking. The most important thing, though, I think, is awareness. People have to be aware of the disease. They have to understand what these symptoms might be. There are plenty of educational platforms out there through classes or online. And that's really kind of the focus of the American Diabetes Association for Diabetes Awareness Month. So.
Well, Dr. Hightower, thank you for talking about this important information today. If you want to know more about Southcoast Medical Group, the information is right there on your screen.